Okay, great. Welcome everybody again. As mentioned, it is our 50th meeting of the Health Innovation Community Partnership here today on January 7th, 2022. We're going to go ahead and do a few quick tech tips to get our group together as we get started with our meeting. As we do every time, please do remember to mute yourself unless you are speaking. And we also encourage everyone to look at the bottom of their screen and pick the language of their choice via the interpretation button. You can also take a look at the participants who are joining us today by the participant list located at the bottom of your screen. And there's also an opportunity to raise your hand or ask a question through the reactions button. We encourage people to really engage in the conversation with our presenters today. We have several wonderful presentations and they're ready for your questions. So please feel free to ask questions at any time. We encourage you to use the chat feature, to raise a hand, or to take advantage of when we call for questions during open mic. I'll kick us off by reading our HICP guiding principles, which were from our vision and mission document. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reached our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to jointly make shared decisions. Participants will jointly design next steps. All right, so let's take a look at our agenda for the day. As mentioned, we have wonderful presenters joining us, and we're very excited to welcome, of course, Supervisor Hilda Solis, who will be kicking off our meeting at 9 o'clock this morning. We're also delighted to have an update again from our medical center. We'll have a couple wonderful updates from Supervisor Solis's team, including a transportation update, an update on LA County redistricting, and an update on the Care First and Community Investment Project. Finally, we'll conclude our meeting today with an update on the General Hospital Feasibility Study, which is relaunching, and we're very excited to update you on where things stand with the study and on the next steps and how you can be involved. So with that, I want to welcome everyone to, once again, our 50th meeting of the Health Innovation Community Partnership. As we kick off, I thought we'd start with an idea of how we got to where we are today, how we got started, and kind of what our accomplishments have been over these 50 meetings and 5 years. Our organization, the Health Innovation Community Partnership, was founded by a board motion by Supervisor Hilda Solis and Sheila Kuehl in March 2017. The desire there was to seize the opportunity to build and develop a master complex of healthcare innovation, restorative care, and restorative justice. The idea was that as anchor institutions, LA County and USC must commit to a process that prioritizes meaningful community engagement and delivers equitable development, investment, and services that benefit current residents. The motion, also directs the CEO to initiate an ongoing partnership process to define shared vision, goals, and metrics for success of the health and health sciences complex, and ensure that the use of county assets and development in the area is responsive to community needs and priorities and tied to near and long-term community benefits. We're so grateful for this motion that created the Health Innovation Community Partnership and set us on this path to create this equitable partnership table where all come together to jointly design a strategy to improve the life, health, and well-being of the communities adjacent to the LAC-USC Medical Center campus. The model that we've adopted is one of partnering an effective structure with an informed and engaged community, ultimately to deliver meaningful community benefits. In our first years, 40 invited members representing county agencies and community leaders came together in July 2017 to bring a diverse and balanced perspectives to the work and to authentically engage in discussion and review of the development opportunities and public planning in a collaborative environment. We've always committed to an open and transparent process. That's why these meetings are open to everyone. As part of the work in those first meetings, we drafted a vision statement and ground rules and studied multiple county projects, including the LAC-USC Restorative Care Village, Alcazar Yards, Central Juvenile Hall, and the Bioscience Corridor. Then we did what we were most committed to, which was reach out to the community and hear from the community directly. We hosted a series of 6 community at large meetings to introduce the Health Innovation Community Partnership to our surrounding neighborhoods. We heard back from people. We had hundreds of attendees, thousands of comments received, and we were able to prioritize the needs of the community across the various identities that were defined by the various communities. Then we really focused in on how do we leverage those ideas and the needs of the community as represented, and made sure that there's community benefits delivered through the projects that the county is tackling in this area. We formed a local and targeted hire subcommittee. We hosted a job resource fair. We're participating in the General Hospital feasibility study. We've informed the Restorative Care Village and the Third and Dangler projects, among many others. We also have notable policy successes over the last many years, including participating in the Community Benefits for County Economic Development Projects policy, participating in opportunity zones and development of county strategies for social impact, countywide local and targeted worker hiring policy, developing a bioscience overlay zone, women and children's hospital demolition project, the feasibility of repurposing the LAC-USC General Hospital building for housing and mixed-use purposes, and expanding the capacity of the LAC-USC Medical Center to better serve the health, well-being, and socioeconomic needs of our most vulnerable residents through the Restorative Care Village. And then we have engaged community participation on a wide range of economic development projects in the region. Ultimately, why we are here. We're here to create and share a vision and a commitment to create sustainable, inclusive partnership model that engages community, county, and anchor institutions in a planning and review process for new developments and projects that result in a healthier community for all in the near and long term. And we are so excited to welcome back to the table Supervisor Solis, who initiated this incredible partnership back in 2017. And of course, all the members around the table who have joined in authentic conversation and dialogue, who have helped lead and guide and build this table to be what it is today, to be a preeminent voice that helps represent the needs and the desires and the voices of the communities surrounding the LAC-USC Medical Center campus, to ensure that community voice is well represented and respected at the table as the county agencies and other large anchor partners think about the projects, priorities, and developments that are in our community. With that, I'll turn it over to my colleague, Rosa Soto, who will wrap things up for us and provide an introduction to our comments by Supervisor Solis. Rosa.
Good morning, everyone. Thank you so much, Heather, for reminding us where we have been since 2017. And thank you to Supervisor Solis, who is joining us today to kick off our 50th meeting. We are so very grateful for the opportunity to provide equitable space where we can dialogue on issues that most affect our community every day. We are also grateful for the opportunity to have a framework of community benefit that can truly inform a broader intention in terms of how we address community need. Now more than ever through this pandemic, we have learned that the needs of our community are not 1, 2, and 3, but they're ever evolving and unfortunately ever growing. And so as a collaborative space that provides a partnership table, we take our job very, very seriously, ensuring that when we bring opportunities up, whether it's funding or a development project or an opportunity for engagement, that there is always opportunity for community to uplift your voices. So without further ado, want to just thank Supervisor Solis for joining us today. Thank you, Supervisor, not just for the motion that launched this Health Innovation Community Partnership, but for your always tireless efforts to ensure that community voice is always front and center in everything that we do, whether it be an event, a community project, a motion, right, a policy, or this collaborative and partnership space that we bring. So thank you for always prioritizing the importance of community speaking for themselves and uplifting their needs rather than others speaking for them. And thank you for being that incredible leader that we can all count on each and every day. So without further ado, Supervisor Solis.
Thank you, and good morning, everyone. Buenos dias. And thank you very much, Rosa and Heather, for your superb leadership throughout the last 5 or I want to say 6 years. It feels longer, but you know, we have grown together, and I really do feel like we are more than just a team, that we're really familia. And I really want to thank everybody that's on this virtual meeting today, and especially all the people, volunteers and folks that have given so much of their time. You know, this is such an important time for us right now to understand that even though we have challenges, we're facing challenges with the pandemic again, that's not going to somehow stall our efforts to move forward. In fact, it's going to invigorate us to want to do more, because now more than ever, we know that there are tremendous gaps in terms of healthcare, jobs, education, quality of life, addressing homelessness, and really taking care of our community in a different and meaningful way. And I think now is that opportunity. And I can't even believe, Rosa and Heather, as you guys have stated, how many meetings have been held. This is the 50th. Oh my God. I mean, my hat goes off to all of you. And I want to thank the whole team and everybody at LAC-USC, the surrounding communities, and many of the new partners that we have acquired in this endeavor. I really appreciate everybody's effort and time. I can't believe that we started back in 2017 and that we really made it a priority to look at making sure that we had a robust, very robust outreach program. And that to me is the essence of, I think, where we go and where we're gonna go for the upcoming years and of course this year. And I do want to say that the Health Innovation Community Partnership members and leaders, we have grown as a tremendous regional force, whether it's helping us to speak out at hearings when we used to have our public hearings here at the Board of Supervisors, or going out and putting boots on the ground to help advocate for more housing, affordable housing in East Los Angeles, as was mentioned, and around the campus, and really galvanizing that support beyond just the borders of the LAC-USC campus, but more importantly, the surrounding communities, Boyle Heights, East LA, El Sereno, Highland Park, Chinatown, and really fostering a bigger presence that I think has to be called upon all the time. And that is that this is also a regional project, because LAC-USC is one of those flagship institutions. And it has served this county of Los Angeles in so many tremendous ways. I can't even begin to go into that. I don't think I have to, but all of you should know that one of the things that I like to talk about is making sure that people know that we serve well beyond our borders, well beyond even the first district. And all of us should be very, very proud of that. We have elevated the community in terms of their need, and we've listened to you. We took to heart your ideas in terms of design, the concepts that you brought forward based on hearings and input from stakeholders, and ensuring that our communities needs were palatable, as well as making sure that they could visibly see that those ideas were incorporated in our developments. And I think that that's really uplifting for all of us. I really do believe this space that we're looking at to envision as our restorative care village is going to be one that's really going to set an example across the county of Los Angeles, because of the way we did it, because of the fact that you held 50 meetings, and we were not afraid to ask, and we were not afraid to invite people of diverse backgrounds. So all of that, I think, helps us to ensure that we have a project that really is engaging with other partners, and that is not afraid to say, wait a minute, let's stop, let's step back a bit if we need to, and let's reassess, and let's make sure that we have the full bounty of ideas, good voices, and the willpower to do it. Because if we don't have that, we can't implement the plan. And I think that's where we're going to go in the coming year. We did a lot this last year. As you know, I served as chair of the board for the County Board of Supervisors. And at the same time, during mid-year, I became the chair of Metro. a Latina that's representing again the entire county, but doing it with the notion that we're going to listen to people and hear where our issues come together in the crossroads of making sure that people have access to better healthcare, access to get to healthcare, and to make sure that Metro is also a big part of that. So that's one of my big goals, to make sure that that happens. We have distributed, as you know, millions of PPE, millions of pounds of food throughout the district. We also were, I believe, were able to turn the tide in terms of the rising numbers of people that were impacted by COVID early on, to turn that around and to say that we could actually help lower it because we met people where they lived. And we did that through our mobile outreach efforts and making sure that public health and mental health and everyone really understood, and DHS, how important it was to go to people. We distributed grants for renters. People, we extended the moratorium so that people wouldn't have to face eviction. We still have more work to do, and we still are coming up with new ideas to create more economic wealth in our community, owned and provided by our community. I think those are important aspects as we move ahead, and you have to be reminded that you help to make that happen. I don't do this alone. I don't do it alone with my staff. We do it with your help, with your voices, and that to me is really, really where we need to go in the future and continue to do that. We have dozens of projects that you know are underway, and the one that I'm most proud of, as you know, is the LAC USC Medical Campus, and furthering our expansion of the Healthy Village vision, and making sure that we can transform the $100 million plus investments that we have already made into this major project. And people need to know that $100 million isn't something easy to come by. And it took coupling, it took advocacy, it took bridging, it took a lot of work that was brought together. And I want to say thank you to everybody that has had a part in that. You know, I care very much about what happens on that campus. I'm very happy that we're also going to be looking very soon this coming year at a new childcare center that will not only serve the needs of employees and staff there, but also hopefully the surrounding community, and that there will be classes offered in terms of expanding our services to people there that may need our help. I also want to say that the former Women and Children's Hospital site demolition took place. Now we're looking at what we can do to provide that space with healing and opportunity. And so we need to understand what happened there years ago, decades of abuse that may have happened and did happen, sterilization that occurred, many things that I don't even want to go into because we're going to put that chapter aside for right now, but we're going to look at how we can invigorate and reinvent and help to restore faith in our community. So we know that that has already been happening. We've even had a ceremony there with the Tongva community and Azteca dancers to help heal the space that was there through a ceremony that we held to help cleanse the land. So that to me is respect and dignity to those many families and people that live and have been impacted by what took place there. The county, as you know, is also going to be issuing an RFP, request for proposal, for 300 plus new affordable units, with the goal of at least 1/3 of the units for extremely low income and homeless individuals and families. We have ushered in an application recently for a successful, what we call SCAG planning grant. That's a way to help us explore a partnership to create an EIFD, and that's a particular financial tool that will help us, I think, attract more investments, private investments, but also work with us in terms of a public-private partnership to get more sustainable funding to come in, because our dollars, as you know, are limited by the county as well as the state. So we need to be creative, and I thank all of you for being a partner with us on that. We need to leverage additional funding. Right now, I have a letter into our governor, Gavin Newsom, who's been very supportive of us and requesting up to $250 million in funding to create a higher number and deeper level of affordable units at the old General Hospital and Western Campus. And right now, we know that in a few days, the governor is going to be releasing his state budget. There's a big surplus there. Let's hope and pray that he prioritizes LA County, because I know that he cares very deeply about the residents here, and he's shown that time and time again. We've also, through my own discretionary funding, provided over $30 million that's available through the I-710 North project. And this is important to note because as a member of Metro, if you recall, there was for about 40 years, this idea of plowing into El Sereno and South Pasadena and creating the 710 extension. Well, apparently minds came together and they said, we don't want that, but we do want to alleviate congestion, and we want to have better thoroughfares so that people could get to point A, B, and C. And for me, it's very important that we look at creating a new bus rapid transit system along Valley Boulevard and Mission, and also help to create a new MetroLink station that will stop right there where LAC USC parking structure is, and hopefully get more people that can't be, that are transit dependent, to be able to use that infrastructure to get to see their doctors or get to their home or their place of employment. All of that being said, that this can only happen through the Health Innovation Community Partnership. So moving forward, we have a lot more to do. We're going to be conducting the feasibility study, as you all know, and this is going to be a challenge because of the pandemic. But again, I don't want that to hinder us. That's why we go online. That's why we have these virtual meetings, and we continue to let our community know what is happening. My vision, again, to underscore, is healthy village for all. And that means looking at our surrounding community, making sure that we have a sustainable mix of uses for different populations and amenities. And I saw someone in the chat saying, let's not forget the employees that work on campus. By all means, they have been an integral part of this process. So let me underscore that. If you're not aware of that, I'm sure other people here today can help attest to that in their participation. So as we move forward by rehabilitating and modernizing the General Hospital and restoring it to its iconic status, I hope that we will all remember the times that have been spent to help put the pieces of the puzzle together. And again, I know moving forward that we can have much more opportunity by working with our local government, working also with our city government, as well as our state and federal level of governments. And once they know what's happening here on campus, I think they're going to just step back and say, wow, how amazing. How did that happen? For a county that represents over 10 million people, that this was a true priority and a dream that really lifted the voices of people for so many years that have not been taken, in my opinion, seriously. And now we are here at that point. So again, I want to thank all the team. I want to thank the familia, because I want to say that, I want to underscore, we're a familia. And again, just praise the leadership, the tenacity, the hours that you spent, because it has not been an easy challenge. I know that. And we're going to continue to work with our CEO here, as well as all the individuals and stakeholders that need to be a part of this program. So again, thank you, felicidades, y próspero año nuevo. And I look forward to working with all of you. And best of luck, and please stay safe. I know you will. You guys are our leaders, you're our voices. So muchísimas gracias. Thank you for the opportunity to see you and to know that we're going to continue this effort. Thank you. Thank you.
Thank you so very much, Supervisor, for your incredible just overview of everything that is the strength of our community, and the incredible portfolio that SD1 has brought forward, that you have led to ensure that we are always addressing the needs of our community. The table that we have today, as you know, is one where we have community members, organizational leaders, and county partners. One of the things we wanted to do before we, because we know how busy you are, Supervisor, and just appreciating your time with us, was to open the floor to any reflections that partners may have about this 50th meeting mark, and to ensure that we continue to hold the space that has gotten us through this incredible time of the pandemic, even through Zoom. So with that, I want to open up and say again, thank you, Supervisor, for your leadership, and open up the floor to any of our partners who would like to share their reflections. I know I saw a few of you make some comments in the chat. Is there anyone who wants to speak? Just raise your hand or unmute yourself.
Good morning, Rosa.
Good morning, Alex.
Good morning, everyone. Good morning, Supervisor. There's one thing that has stood out to me. I really appreciated all of your words this morning, Supervisor. Actually, I was still a little bit asleep right now, and your words woke me up real quick this morning. The one thing that stood out to me was the speed at which we are having to move during the pandemic. Our communities have suffered, but have persevered. And it's unfortunate that it's come to that, but resources are finite. And that with your leadership and the leadership of the community, we need to move fast and be able to secure those resources. And that's something I really appreciate that from everything that I've taken from what you've shared this morning. That's one of the things that I hear most, is that we have to move fast and we have to be diligent, and that we have to make sure that we secure these resources and the ability to deliver these resources for our communities. So with that, I greatly appreciate this morning, and I look forward to seeing what all this hard, diligent, and fast, speedy work will yield for the coming year. So thank you.
Thank you.
Yeah.
I see a raised hand, Teresa. Would you like to make a comment?
Yes, I see the other Teresa Velasco as well, but Teresa, you will follow.
Sorry, that wasn't very clear. There's two Teresas on the phone. Teresa
know,
Nuño, followed by Teresa Velasco, please.
Yes, Supervisor, thank you so much. It's a pleasure starting out the new year with us. And following on Alex's comments, I think what stands out for me, first of all, you captured so much that it is sometimes very difficult for us as a community to really capture the depth of what we've accomplished and how to celebrate that. So thank you for that, feedback to us. Something you said at the start of all this, like you said 5-6 years ago, unbelievably, is how we had an opportunity to establish a model. And I've often shared with the group that I believe we're really establishing the evidence to demonstrate that. And that will also help to strengthen our future work and sustainability as a community to continue this agenda that you really forged with us. Finally, I want to say that, something that you said reminds me too, and it's very deep, and that is the trust that your leadership has established with the community in ways that I saw when we started the base and level of partnerships and relationships that were there with the county. And I've seen how this has flourished and strengthened, as evidenced by the accomplishments on the policy front and advocacy and engagement with community. So muchas gracias, abrazos, and to you and all of us.
Thank you, Teresa. Teresa Velasco, no? Hola.
Thank you. Hi, good morning, everyone. My name is Teresa Velasco. I work at LAC. I'm in the emergency room as a clerk on night shift. So for me, the campus is home away from home. So I really would like to be a part of the feasibility study. And I know that dates should be coming up shortly, and I'm just hoping that a calendar can be set for that. So, and again, I ditto everything, all the good work that Supervisor is doing, and all the supervisors. Go women of 2022. Thank you.
Thank you.
Diego, followed by Juana.
Good morning, Supervisor, and good morning, everyone. I just want to express my appreciation for the tone that was set by you, Supervisor, and by the First District through your motion and in creating this space. I think this partnership reflects the inclusive and responsive leadership that the First District has demonstrated. And for as diverse as we are, because this group is incredibly diverse, Every voice truly matters, and it's reflective of the communities that we serve. We are the community. So just want to express appreciation for this incredible space that we have made together, and for the ability that we've seen to transcend just a space for ideas, but for action. So many efforts have started and or being expended through the hard work of the members of this partnership. So thank you for your continued support, and thank you for all the members of the HICP and for the opportunity to be part of this group.
Great, thank you.
Juana Mena.
Gracias, Heather. Supervisora Solís, quiero agradecerle por todo su liderazgo y el apoyo tan grande para beneficiarnos en la comunidad. Yo, en voz de todos los residentes que no pueden estar ahorita, le agradezco todo su trabajo a usted y a todo su equipo, siempre, pero principalmente en estos tiempos de pandemia. Que Dios la bendiga. Muchas gracias.
Gracias a usted, la comunidad.
All right. I know we still have comments coming through the chat, so we will collect those, Supervisor, and share them back with you. But you can see a lot of gratitude here. Great representation from SD1, from our community. And I know we don't have a lot of, I actually don't think we got any comments from county partners, but I just want to appreciate them. A lot of our county partners, come to the table not only every month on this call, but at every small group meeting that we have to ensure that we're prepared for every process, be it feedback to policy, be it a roundtable discussion, be it workforce development, that we're still continually working very strongly on, just to name a few. And just want to appreciate our county partners, because I know that, it takes a commitment, right, to be part of a partnership like this. And so just appreciating the CEO's office, the Department of Health Services, the Department of Public Health, and every partner that we have had, the Department of Public Works, right, that have been incredibly generous with their time and efforts through the partnership experience.
I see Ivan there. Thank you, Ivan, for being a part of the team. Appreciate you.
Thank you, Supervisor. It's been a wonderful experience getting to know the community and being involved with the HICP and getting to support you and your staff and helping make the reuse of General Hospital and West Campus a reality and moving forward with a RFP here this summer. Thank you very much for the opportunity, and thank you, community, for working with us and raising your voices and your concerns to allow us to incorporate it into the future reuse of the hospital and West Campus.
Great.
And I just chuckled at Pam's comment. She said, "I'd love to talk, but I'm not feeling so well."
Oh.
Sorry that you're not feeling well, and really wish the best health to everyone. We know so many of our community is sick and going through Omicron, just this difficult pandemic. But thank you for sharing your thoughts, Pam. And again, we just wish everyone well and appreciate each and every one of your time and efforts in this space. So with that, Supervisor, I don't know if you have any other comments. We will turn it over to Heather. We were going to have the LAC USC Medical Center update immediately after you, but fortunately, as you all know, because of this surge, right, they are so very busy. So they're trying to come on as soon as they can, and we'll bring them on as soon as they hop on. We'll cede the mic to them so that they can give us an update of how it's going at the medical center. So we will, then continue on with the agenda until we can reflect back with the medical center team. Back to you, Heather.
Thank you so much. Well, what better start to the year and to our 50th meeting than having this reflection time together and having, of course, Supervisor Solis join us to reflect back on the history that got us to where we are today and what incredible progress we've seen. One of the topics that Supervisor mentioned was some of the new transportation updates that are going to be happening in the area. So I'm super delighted to welcome Martin Reyes from Supervisor Solis's office to give us a quick update on what indeed is happening around transportation and how that might impact the communities around LAC USC. With that, Martin.
Thank you, Heather. Good morning, everybody. Happy New Year. It's very nice to be with everybody today. My name is Martin Reyes. I'm the Transportation Deputy for Supervisor Solis. I wanted to give a brief update to everybody on what's going on with transportation around LAC USC. As a supervisor mentioned, she pretty much covered everything that I was going to say. I'm just going to dive into a little bit more detail. We have several efforts ongoing at LAC USC to improve transportation access around the area. One of the projects that the supervisor mentioned was looking at additional transit around LAC USC. And there's a project being led by the city of LA right now called the Valley Boulevard Multimodal Transportation Improvement Project. It's a long title, so we usually just call it Valley Boulevard BRT. But it's a project being led by the city of LA right now to examine transportation enhancements along Valley Boulevard between the 710 freeway and Union Station, with LAC USC being kind of like a jewel in that new transit line. This project is actually a result of what the supervisor mentioned, which is the 710 North. After the 710 North was ended by the Metro Board of Directors, there was leftover funding, about $1 billion in funding from the 710 North that was reallocated to other projects. The city of LA chose to use some of their funds, about $34 million, to enhance Valley Boulevard. And that's actually what led to the study that city of LA is leading right now. In addition, the supervisor also chose to set aside about $30 million from the county's allocation of 710 North funding and set it aside for LAC USC access improvements. So some of that is going to be used to support the Valley Boulevard project, but some of that we also wanted to use to make sure that residents, visitors, and employees of LAC USC could easily access the campus as much as possible. So we have been talking with the city of LA to see if there's a way to align those two efforts to maybe expand the Valley Boulevard scope to also include access improvements to LAC USC. So we're continuing those discussions with the council district. I believe the Valley Boulevard, the larger Valley Boulevard Multimodal Transportation Improvement Project, the BRT project, that one kicked off last year, and they're still going through their feasibility study right now, looking at different alternatives along Valley Boulevard. So we will be coming back to HICP with more information once that collaboration has sort of been fleshed out a bit more. So that's my quick update on the Valley Boulevard BRT project. I also wanted to give an update on the other project that the supervisor mentioned,
Hey,
which is—
Martin, just before we move on, why don't we see if there's any questions specifically? We can maybe take questions for each of the segments as opposed to at the end. Does anyone have any questions for Martin about the Valley Boulevard project? Anyone have a burning question that hasn't been answered by Martin yet? Oh, I see a couple hands raised. All right. Let's go in order that I saw you. Teresa Velasco, followed by Dr. Thomas Williams. I think that's Williams.
Hi, good morning. So again, as I mentioned, I work in the emergency room. So if that bus is going to go like from the 710 down Valley, if it can kind of make a left on Zono and go through State Street, that would really help our patients leaving the emergency room at 2, 3 in the morning to get to Union Station, where from Union Station you can get anywhere in Southern California. So just that's my comment. If it can kind of like do a little detour, come through State and then back up Marengo and then continue down Valley, that would be amazing.
Thank you, Teresa. I'm taking notes, and I will definitely bring this up with the city of LA and the consultant to make sure that your input gets incorporated there. I appreciate it.
Dr. Williams.
Hola. Hola. I'm sorry, Dr. Tom Williams, or Thomas, and I am a member of the Land Use and Development Committee of the LA 32 Neighborhood Council. And we have heard nothing from you guys or from LA City directly. So we're quite concerned because we see it, it's not only Valley, but it's also the Soto Street and the bridge that's being reconstructed now, and the existing new intersection of Soto, Huntington, and Mission. So we're quite concerned regarding the land use development impacts of the 710 funding, which is paying for all of this. And I say the growth inducement that the Keck Center is giving us in El Sereno. A lot of projects have been proposed, some of them defeated, that will be directly supporting the growth in the medical center area. So we're quite concerned about being left out. That's all.
Thank you, Dr. Williams, for your comment. And I apologize, if the neighborhood council has not been engaged on this project just quite yet. I will, if it's okay with you, follow up with you after the meeting, and we can maybe have a chat with CD14 and the City of LA and their consultants leading the study. That way we could get the neighborhood council fully briefed and engaged on the project. But I will definitely follow up with you after the meeting.
We have one comment in the chat, Martin. It's from Pam. It says, good comment. Is the process now at the point of mapping desired stops? How will existing bus stops be impacted?
It's a good question, Pam. And I think that the scope of the study is actually very large. The bus line is just going to be one of the elements that they're looking at. They're also looking at a number of other things, including protected bike lanes. They're taking a look at the existing rail line that's there and seeing if there's anything that the City of LA can do to improve it and keep the rail line from disturbing the neighborhoods around it. So the scope is very large. I don't think it's really at the point yet where they're actually looking at individual stops or relocating stops or anything like that. But that is a very good comment to keep in mind. And I know something that HICP needs to be engaged on. I don't think it's there yet, but I will definitely check with City of LA. And if once we do get to that point, that's something that we definitely want to have some heavy outreach on.
Thank you so much, Martin. Yeah, I know we all want to strongly advocate for greater connectivity of our medical center campus to the communities, particularly for patients and staff. So we really appreciate all those efforts and you coming here to update us on what's going on. All right, moving on to the next project. I don't see any more questions related to this particular issue, so we'll let you move on in your presentation.
Thank you, Heather. And then just the other quick update I wanted to give was on the other project that the supervisor mentioned, which is looking at a new Metrolink station along the San Bernardino line. So as you all know, just south of LAC USC campus, the Metrolink San Bernardino line runs. And Metrolink actually has a project in the works right now. I believe it's in final design. And I know they came to HICP before. They have a project called the Marengo Siding Project, which is basically going to add another set of tracks next to the existing set of tracks along the San Bernardino line near LAC USC and Marengo. And that helps with the efficiency of Metrolink operations. It allows for room for trains to pass each other when there are two trains headed in opposite directions. So we decided to kind of capitalize on that project, and we asked Metro to work with Metrolink to see if LAC USC could support a new station along the San Bernardino line. So the San Bernardino line, as its name implies, it travels from Union Station through San Bernardino County. There's a station at Union Station, and there's a station at Cal State. There's a Cal State LA, I believe. And we wanted to see if there could potentially be a new station in between. So earlier this week, we had a formal kickoff meeting between our office and Metro to formally launch the study that's actually going to see whether or not a new station for Metrolink is feasible here. So they're going to be looking at all sorts of things. They're going to be looking at at constraints within the project site itself, how much room we have, and if any right of way would be required to actually build a station. They're going to look at Metrolink operations. Typically, Metrolink lines, because they're regional commuter lines, their stations are typically spaced further apart. And that's because you're traveling such long distances from San Bernardino County to downtown LA. So their stations are usually stationed further apart. There will be some operational impacts that Metro is going to look at. Overall, they're going to see if the station is just possible and recommended. And they are going to be coming to HICP to formally present on this project in an upcoming meeting. And they will also be doing some outreach and engagement to the neighborhoods around LAC USC. The study is expected to be completed later this spring, early summer, April, May, later this year. So it'll move fairly quickly. It's important to note that there is no funding identified for a station yet. So this really is just the early stages of figuring out whether this is even a possible project. And once we know that, that's when we can really start advocating for funding, especially federal funding through hopefully the infrastructure bill and any other funding that's out there. So with that, that's my quick update on the Metrolink USC station. Heather, I'll throw it back to you. Happy to answer any questions.
Thanks so much, Martin. There was one question in the chat. Maybe you could respond to that. And then we have one question from Alex. We want to move a little bit quickly because we do have Edgar Solis with us, and I know his time is really precious today. So Alex, if you could keep your question short and to the point, and then maybe Martin, you can respond in the chat. That'd be awesome.
Sure.
Thank you. Alex.
Thank you, Martin. Good morning. I was wondering how this study will incorporate the crossing at San Pablo.
That's a good question, Alex. So one of the things that we're looking at actually is as part of the study, Metro is going to be looking at first last mile enhancements. So anything to improve pedestrian and bike access between the station and nearby areas. So we haven't identified specific intersections or roads, but it's going to be taking a buffer really of between the potential station around the neighborhood and identifying any barriers to access. So the San Pablo crossing, I'll definitely bring it up with Metro and ask them to take a specific look at that and see how we could better incorporate it into the study.
Great, thank you.
Thank you so much, Martin, for your updates. It's always really interesting to hear what's going. These are long-term projects, but they're so fundamental. Everyone who lives in LA knows transportation is key to our happiness and well-being in the community. There are, as mentioned, a couple questions in the chats or comments in the chat, so maybe Martin, you can respond there. All right, with that, thank you so much again for your presentation, and I'm delighted to welcome Edgar Solis, the Chief Operating Officer of the LAC-USC Medical Center, to provide an update for us on how things are going at our fabulous medical center campus. Edgar. Oops, Edgar, are you on mute? I'm not sure if maybe Edgar fell off by mistake.
Yeah, I don't seem to find him. Maybe he accidentally fell off.
Yeah.
We do have a few more comments in the chat. We can continue with Martin for a second.
Yeah, I was going to suggest the same thing. So Martin, guess what? You're back up. If you don't mind, maybe you could respond to some of those questions out loud so everyone can benefit from your perspectives.
Sure, and I was just reading through them. So I see one question in the chat. I work with cancer patients from the local community. Many of them receive treatment at the LAC-USC hospital. I see how much they struggle to walk from both the parking lot and from the bus stops to their appointments. Since we can't modify the hospital, can you please propose Metro to add more public transportation lines that drop off people at the village bus stop. Thank you so much for this comment. This definitely is something that we're looking at as part of the study too. I know that there are some existing bus stops within the campus that Metro had mentioned to me. So we will be looking at whether or not we can add more stops to improve access between the new station and the LEC USC campus. So we'll definitely take a look at that. I see another comment from Teresa. At the freeway bus stop at LEC USC, really need cleanup, lighting, and security. That's also going to be part of the study too, as part of first last mile access. So thank you, Teresa. We'll definitely bring that back to Metro. And I think that's it, Heather, unless there's anything that I missed. And if anybody else has any other questions, please do feel free to send me an email. I'll drop my contact information in the chat so that you have it. Anytime, feel free to reach out, whether it's about this or another transportation project.
Thank you so much, Martin. We really appreciate your time today. With that, I am delighted to welcome Edgar Solis. As mentioned, he's here to provide us an update on the LAC USC Medical Center campus. Edgar, welcome.
Hi, good morning. Happy to be here, and Happy New Year to everyone. We're holding up. This morning, as you all know, in the last 24 hours, there was a huge increase in the number of cases that were identified through testing. And for the most part, a lot of these cases are mild disease that really don't require hospitalization. However, this morning we do have 75 COVID positive patients, which 35% are here for actual COVID disease. So what that means is patients that tested positive that are exhibiting symptoms of COVID-19, and the physicians determine that they require hospitalization for COVID disease to treat COVID disease. The other 65%, since we test everyone at admission, the other 65% are those patients that are here for maybe a trauma case. They got in a car accident and they need to go to surgery, or they've had a heart attack, or they had a stroke, but they just happen to test positive. So they're not here for COVID disease. They're here for another reason, but they happen to test positive. So we continue to see, again, admissions that are COVID positive, but for the most part, they're mild cases. For example, this time last year, we were up to around almost 200 cases in the hospital, most of which required intensive care in the ICU. But we're not seeing that with this surge this winter. Like I said, it's more of a mild disease that require a lower level of care, maybe some oxygen supplementation, but not really intervention in the ICU. And a lot of these cases are really unvaccinated cases. The cases that require ICU admission are generally unvaccinated cases, or cases that are that have been vaccinated but have other comorbidities or are immunocompromised. But so it's not really an intense surge of patients like we saw last winter. What's really affecting us is our staffing. Since COVID is very endemic, or there's a lot of cases in the community, a lot of our staff are community members as well. And for that reason, they're gathering with their families, they're gathering with friends, and they're also being infected by the latest variant, Omicron. And so what happens is they also may have mild disease, but we have a policy that you test positive, that you quarantine for a specified amount of time before you can come back to work. And it's really impacting our staffing. And it's not unique to LEC USC. It's generally every hospital in LA County is really going through this staffing crunch. But we're able to maintain our staff is very resilient. They're very committed to their work. And we're very grateful and thankful for all of our staff, from nurses, physicians to ancillary staff, EVS, facilities management, dietary workers. They're here every day continuing to provide and being available to our community when they need our services. In terms of supplies, we're holding well. We learned from last year's experience, and so we prepared knowing that this was a possibility of having an additional surge this winter. So we're okay with PPE, we're okay with masks and gowns. And our leaders, our nursing leaders, our clinical ancillary and physician leaders are doing everything that they can to ensure that we're supplementing our staff to ensure that we meet those levels that are required by our patients. And so we're doing okay. Definitely a lot better than last year. And I remind our team every day that I'm grateful that I'm going through this experience here at LAC USC, because I'm working with this team is just incredible and dedicated to the community. So we're holding, we're doing well so far, and we continue to fight. And so my message to you is from the community members is continue to get vaccinated if you haven't already. Get the booster shot if you haven't already. Encourage your family members, your friends, and your community members to continue to get vaccinated, because that's our number one tool to fight and get over this pandemic.
Thank you so much, Edgar. We know that it is really challenging times for everyone on the LAC USC campus. We appreciate your incredible efforts, your incredible strength to move forward. We have several of your coworkers on the chat log with us right now, and we just want to kind of show our appreciation and respect for everything you guys are going through right now, and just keeping us safe and providing excellent quality of care, compassionate, heartfelt care to our community. So do people have questions that they'd like to pose to Edgar? Hear a little bit more about how the campus is managing despite these very challenging times. Questions for Edgar?
Quick question, just in terms of mortality. I hate to put it that way, but I've actually had several people in the community that I've heard secondary that were asking about that. How much more? You did say we're doing much better than we were last year, but in terms of mortality, is that less or more significant than last year?
It's less significant than last year. Last year, we were at the verge of providing the vaccine to everyone, and I think that's been key. The key difference between this year and last year's outcomes in terms of COVID-19 disease. We are seeing a significant, and as I follow the numbers in the county and comparing to last year's, it is a lot less significant. If we look to South Africa's experience with the COVID-19 Omicron variant surge, their numbers are also similar to ours, in where it's not a high mortality type surge as compared to the winter surge. So it's significantly less than last year.
Yeah, there's that skepticism that still lingers in the community about vaccinations. I think that we should champion that and help people understand that we still might contract, but again, there's absolute benefit to be had. So thank you, Edgar.
Yeah, sure, no problem. Our epidemiologist, our CMO, Dr. Brad Spellberg, always reminds us that immunization does not mean you will not have the disease. It's not 100%. He reminds us that no vaccine is 100%, to prevent a disease. But what it does, it does prevent mortality at significant amounts. And so that's the primary reason, as you pointed out, sir, is the reason why we want people to get vaccinated, is to prevent serious complications and death from this disease, which I think we're seeing because of the vaccination rates that we have here at LA County.
Thank you.
Sure.
Teresa Velasco.
Hi, good morning. I just want to share I'm in the emergency room and I see my nurses have 4 patients instead of 3. I see our whole east closed because we don't have staffing. I am not opposed to getting vaccinated, but I just really wish that we can find a middle ground and bring our nurses back by testing them, because the nurses that are showing up are overwhelmed and getting sick from coming to work, not necessarily having the privilege or being able to visit with family because they're so exhausted from work. So I just wanted to say that I just wish we can bring our nurses back to do patient care so we can have, our wait time in the emergency room is going on 13 hours. You're waiting 13 hours to see a doctor. You're in that lobby, a field lobby, mind you, potentially sitting next to somebody that is or does have COVID. So it's just a really bad setup, and having the short staff doesn't help. And then it trickles onto inpatient to where they're not staffed upstairs, so beds are not opening, and we're housing inpatient patients in the emergency room for 2 to 3 days. So I'm sorry. I know everyone's doing the best they can, and I just wish that we can find a middle ground to bring back our nurses. Thank you.
Yeah, absolutely. I sympathize with everything you say, and it starts from the pre-hospital care, and what that means is when the ambulances are coming to our ER, we're already talking with them to identify if they're COVID positive, if they're not COVID positive, or what their symptoms are, so we can start from that to manage their care through the continuum and through the ER. Even patients that walk in are screened at the door so we can segregate them in the lobby. We provide them with masks as soon as they come in, which help them prevent transmission once they arrive into our hospital. So our epidemiologists and our nursing staff are very diligent in ensuring that they're not cohorting those that are here for symptoms consistent with COVID and those that are here for other reasons. So we have some clear separation. In terms of staffing, yes, our Chief Nursing Officer, Dr. Nancy Blake, has made huge, tremendous changes in our nursing, even before COVID, preparing for what the eventual surge that we might be seeing in this winter. And so we've prepared. We've have contracts with multiple staffing agencies that are continuously sending us registry staff in terms of nursing. For example, we just hired on about 60 nurses to help and assist with our staffing. And in terms of employee health, just this week we had an emergency meeting with the leaders to try to identify solutions through our employee health process to get our nurses back that are well enough to come back to work, meeting the CDC criteria to return to work, so we can get them back as soon as possible. I know our nurses are eager to get back to work and help their colleagues because their colleagues are struggling. But again, this struggle is not unique to just LEC USC. This struggle has really affected every hospital, as we hear from our EMS partners that have oversight of a lot of the ERs in the county. So I empathize with your statements, and rest assured that we're committed to do everything that we can to not only ensure our patient safety, our staff safety, but also get our staffing levels to meet the demand from the community.
Thank you, Edgar. Yes, it is a significant challenge, I know, juggling so many priorities and just meeting needs in the middle. Do we have any additional questions for for Edgar, pardon me. I'm channeling Jorge through you, Edgar, apparently.
We look alike too, right?
Well, definitely you both you both are so emblematic of the incredible leadership of our hospital. So in that way, definitely you very much look alike. All right, I think with that, we will say thank you again for joining us today. We know that you have so much on your plate. All right, we'll move on with this. I'm very excited to now welcome. Thank you again, Edgar.
Thank you.
Muchas gracias to you and everyone on your team and at the LAC USC Medical Center.
Feliz año. Gracias.
With that, we're delighted to move on to another presentation by a member of Supervisor Solis's staff. Wakas Rehman will be presenting on the on redistricting, on LA County redistricting. As we know, this was an initiative over the last year, and we have some updates to share with you all about what the outcomes are of the redistricting process. With that, I'll ask Wakas Rehman to join us and share some updates with us.
Thank you, Heather. Good morning, everybody, and very happy New Year to Healthy Innovative Community Partnership. So good to see you all. So happy New Year and happy Friday. I'm joining by my phone, so I'm trying to make sure everybody could hear me okay. Okay.
Yeah, you sound great, and you look lovely too. The pocket square is wonderful.
Thank you, Heather, and happy to be joining here, and I'm covering for my colleague on this very important topic. So if I don't do justice, please let us know, and we'll try to get my colleague who's been the subject matter expert from the office and been following this very critical issue for some time. This is about the redistricting. So the redistricting, as many of you may have followed it, happens every 10 years after the US Census. So I'll be very brief and concentrate and focus on the brevity and content here. We'll go over a little bit about what is redistricting and what happened with redistricting, that process that ended mid-December last year, and how it reshaped our boundaries within the county, specifically within the first supervisorial district. So just quickly going on redistricting, as I mentioned, after census, every 10 years, we go through a redistricting process. Why it's important, it ties to all the municipal services. So earlier comments by the supervisor and reflection by Alex, we knew there are finite resources that we all struggle with and try to provide based on through an equitable lens. And all that ties into how those boundaries are shaped. And that is an essential, critical part of our political process. And that ties into public health, public medical centers, tax assessments, public social services, fire and safety services, all types of municipal services within incorporated cities and unincorporated part of the counties and our contract cities. Why it is specifically challenging in LA County? Well, LA County is very unique when compared to any place throughout the United States, I would say, not just the state of California. 25% of state population actually lives in LA County, and the 10 million plus Angelenos, the population is actually greater than 41 states. So you could put imagine that with respect to other areas throughout the country. It's very, very unique, and it is that richness and significance in its size and diversity actually makes it quite challenging to redraw those boundaries. And with that, there's a citizen redistricting commission that was established with 14 members. There's a big change in process, how redistricting was done in the past and how it was tackled this time, pursuant to a state law that was enacted, SB 2016. In prior times, maybe part of 2010 census and 2011 redistricting, the County Board of Supervisors had the ability to redraw the maps and redraw those lines. But part of the state law, an independent commission was established and charged to do that task. Much of those tasks became public facing and more engaging, I would say, between June and December last year. So for those of you who participated in that process, and thank you for your participation, may know that the 14-member commission was primarily charged and went through voluminous data and number of maps, until a final map was decided, voted on. I'll go over 5 areas where the commission was tasked to look into in redrawing those boundaries. Number one, they had to ensure that each district and then the 10 million people in LA County are roughly divvied up by 2 million people in each district. There are 5 board of supervisors. So first task was that each district will be reasonably equal and total in resident populations. They all should be around 2 million people. Districts should also comply with Federal Voting Rights Acts of 1965. Every effort had to be made to make them geographically contiguous in one area, not patchwork. And then within that, there's a geographic integrity of city, local neighborhood, and what we call community of interest had to be respected. So not diluting diverse ethnic votes, all of that there should be a mindfulness about it. Communities of interest, pockets like East LA, El Sereno, City Terrace, the contiguous community shouldn't be divvied up in any sense. And then to the extent practicable, there needs to be a geographic compactness. They shouldn't be all spread to a very large area. So those are the 5 goals that they had to keep in mind in terms of redrawing lines. So there's a very intense process that accumulated about mid-December. And now I'm going to quickly go into the results, what really happened with that redistricting exercise and how it reshaped the first district. And like I mentioned, the process just ended right before the holidays. So myself and district staff, we are still getting used to and handle on how the boundaries have been redrawn and reshaped. And I don't have the map in front of me to share with you, but probably bring it into one of the next meetings. But generally, the way I looked at first district, going from Eagle Rock down to Southgate by 105 freeway, and then by Silver Lake area to City of Claremont, that was roughly the boundary of first district. It included 26 cities. And I remember it the way we had 8 cities in Southeast LA, from Vernon down to Southgate, and about 15 cities in San Gabriel Valley, from East LA, Monterey Park, all the way to Claremont, and then 16 City of LA neighborhoods in Northeast, including downtown LA. Now it reshaped to more like 20-20-20. So we have now 20 cities entirely in San Gabriel Valley. We don't have the Southeast LA portion from Vernon to Southgate. That's more or less become part of the 4th district, represented currently by Supervisor Hahn. And then 20 City of LA neighborhoods. So, and 20 unincorporated communities. So those unincorporated communities are like East LA, City Terrace, Avocado Heights, Palacier Village, Bassett, Puente Valley, Hacienda Heights, Roland Heights, etc. So we gained more in Pico Union area, several blocks in downtown, all of the Westlake in downtown, some parts of East Hollywood, including Little Armenia, Thai Town. LA City College is now part of First District. We gained all of Atwater Village, added several blocks in the First District. In downtown, we have a big portion of Skid Row added. So all of the wholesale district and entire Skid Row, entire downtown is pretty much in First District now. And the
Wakas, really quickly, I wanted to mention that Ruby Rivera, our partner at Inner City Struggle, has put up the map. So we actually are able to look at the first district right now.
Wonderful, wonderful.
Yeah,
Thank
so
you
we're
so
seeing
much,
what
Ruby.
you're talking about. We have an illustration to go with your words. So
I truly appreciate it, Ruby. Thank you so much for doing that. So yeah, no, I'm able to see it now. And yes, the entire downtown is part of the First District. In Northeast area, if you see, there's a lot more area added in and around the Silver Lake. That's all of that is added. And our focus, LSUSC, medical campus, all of that is retained. It's still part of the First District before and after. Within the San Gabriel Valley and East San Gabriel Valley, I'll mention quickly some cities. Alhambra, City of San Gabriel,
¿No? ¿A dónde?
I think somebody needs to put themselves on mute, but San Gabriel, Alhambra, all of Covina, unincorporated island, Covina, Walnut Islands, unincorporated, Irvindale, Cal Poly, all of that is fully part of the first district now. And we have Hacienda Heights, Roland Heights, Diamond Bar. The cities we lost in San Gabriel Valley is Pico Rivera and Claremont. So essentially all of the San Gabriel Valley and these geographic areas are represented by what we call councils of governments, so COGs. So Gateway COG, which represents more of the southeast, is no longer part of the first district, and we had a lot of focus there, including Exide areas, LA River, and access to parks and open space. A lot of efforts made by the supervisor, but that is not part of the first district anymore. And we gained a larger portion of unincorporated community. And I'll end with this point that in terms of the population shifts, we have first district has the largest unincorporated population now. So unincorporated population where the county has a direct oversight in providing municipal service and acts as a first line of government for 1 million people who live in unincorporated territory, including City Terrace and East LA. That is 35% in first district. And we have the largest number of unincorporated population there. And then the second largest, I would say between second district and the fifth district, they each share about 25% population. The fourth district with losing all the Hacienda, Roland Heights, their population is around 11, 12%. And third district only has 2% of the unincorporated population. So with 35% unincorporated population, we still ask the partnership here and all the residents in first district to help us advocate for larger share of the pie, if you will, of county resources for all types of different health response and projects that supervisor talked about and all the other services that we need for the citizens and residents in Angelenos that live in first district to be more equitable. I know there's a lot more broader discussion. It's a very loaded topic, and at the core of it, it impacts everything we talk about here. But I'll stop and give a chance to for some reflections and questions. And if I'm not able to answer those, I'll make sure my colleague and first district gets back to you. Thank you, Heather. Back to you.
Thank you so much, Wakas. Do we have any initial comments or reflections on what Wakas has shared with us today? And I definitely want to give a big shout out to Ruby for having the map on the fly and able to pull that up for us. Very much appreciate that, Ruby. Any questions for Wakas? Well, personally, I can say I'm excited to see the downtown Los Angeles area more concentrated and aligned with the first district. I feel like that will give a lot of opportunity to really blend the needs across the downtown area into the east side communities that are feeling so much of the impact of the gentrification and displacement from downtown into the east side areas. So that's an exciting opportunity, and we definitely look forward to hearing more back from you and the team as we dig a little deeper into what this redistricting is going to look like across the entire county.
Certainly. Thank you, Heather.
Thank you.
And thank you, Wakas, for that great overview of the redistricting process. I feel like we blinked and the process happened. It's a very intense process, a lot of evenings, a lot of just intense work by also a large number of community partners across the county, right? Giving feedback. I know a few of our partners here in HICP were part of this process. In particular through People's Block, through Inner City Struggle. And I know Ruby, we had asked you guys to share a little bit of your reflections as advocates in the process, right? So I don't know if you'd like to go next.
Yes, thank you for that, Rosa, and thank you, Wakas, for going over the the nitty gritty details of what came forth for us. But I think that this process was also really telling as an advocacy organization of community power and people power. We fought, and when I say we, I mean we mobilized community partners, we mobilized community members to really make sure that they showed up and provided public comment on the maps. And again, even prior to the redistricting hearings, there was work within the People's Bloc where information and was gathered from members of community-based organizations all across the county to ask them for their priorities and their needs and what they identify as communities of interest. And through that entire process, we were able to create draft maps that were submitted to different like levels of government, including like a county map. And when we say VAP and CVAP, VAP is voting age population, which is everyone who is over the age of 18. And CVAP is citizen voting age population, which is folks who are over the age of 18 and have the ability to vote. And the reason that those two, actually, thank you, Catherine, for bringing those up, are so important is because voting is power, right? When we are able to shift the representation within our Board of Supervisors to reflect the people they serve, those numbers of the CVAP numbers become very important. And so in this process, it was a challenge in the county process, because although it was like an independent commission of the redistricting commissioners, their understanding of advocacy we found was quite challenging. They felt that community-based organizations, there was times when some of the commissioners would share things like, community-based organizations are paying their members to speak. They're like all these lies and misunderstandings of what our work is. And it's like, no, we community-based organizations are organizing our members. We're supporting them and telling their story of self and advocating for what they want in these maps. Like these maps are not what Inner City Struggle decided they wanted, right? These maps are what community members all across the county came together through their organizing bases, right? And advocated for their needs. I will say that we did have many victories. One of our goals as the People's Bloc was to create an additional district that had a high Latinx CVAP, right? Citizen voting age population. And we were able to do that while maintaining the integrity and the power within the first district, because we didn't want to minimize that power. That was a big win for us years ago. But by bringing in the Southeast LA communities, as well as some other communities into District 4, so that District 4 now has a Latinx citizen voting age population that's the majority in that area. We still were able to maintain the integrity of the Black, of like a powerful Black majority voice within SD2. And we were able to maintain District 1 and the integrity of District 1 and ensuring that we weren't cutting it in half, right? Removing the east side from District 1. Like District 1 really remained, other than losing, I feel like losing Southeast LA, I think District 1 remained in a space to maintain its power, to maintain the ability for the supervisor to continue to serve in the ways that she has. So those were some of the things. And I think what was hard too was that the process took a really long time and was kind of stagnant. And then all of a sudden in December, there was like a meeting every day, a meeting every week. So it was kind of also hard to get folks to jump on calls and to mobilize our members sometimes because they were burnt out from speaking so much. And then a lot of times too, feeling like they were being ignored. I think that those were some of the challenges, but I really do appreciate how engaged community was in this process. and really understanding, even though some of our members are not able to vote, right? How their power is going to influence the policies that are going to pass over their communities. So again, for me, it's a big thanks to the organizers on the ground that did the work to really build the capacity and engage members and helping them understand CVAP and VAP and mapping and redistricting, which can be such a overwhelming topic, and being able to break it down in a way for all of our community members to understand what they were engaging in and to really be a part of this process. And also to our community organizational partners, community partners that were also in the trenches there, fighting to be heard in these spaces, mobilizing your neighbors, mobilizing your family members, right, to speak on these issues that happen every 10 years and that we're not always all engaged in. And I think we have a map that's gonna be, we won some battles and we lost some battles in this map, but this is gonna be a map that we're gonna continue to push, right, and utilize to continue to support communities. And like Waka said, this is step one, and now we got to make sure that we're in the trenches advocating for funds to go equitably where they deserve to be. So that was what our process was like. And again, a thank you to all of you who supported us in this very long and arduous December, which is usually a time for folks to, kind of chill out a little and enjoy the holiday parties, but not our community. We were advocating on Saturdays, on Sundays. We were on calls till 10 p.m. trying to let the commissioners know what it was that our communities need. So thank you all again. And if you have any questions, I can drop the links to these maps. These are the final maps, and there's two ways to look at the map. One is what I'm sharing now, which is like a PowerPoint that breaks down each district. And then we have another one that's a more interactive website where you're able to click and zoom in and see population issues. Yes, Wakas.
No, thank you so much, Ruby, for your comments, and a big shout out I want to give out to you and many others on this call, but particularly Inner City Struggle for all the work they did. As I mentioned, it was a new process where the board was excluded from the process, right? And it was left to the citizens and the role of CBOs and this the fight for keeping the community's interest. And I know, as you noted, through December, there was a very arduous, complex process. So all the groundwork, everything folks did in terms of keeping the communities, and these are marginalized communities, by the way. So keeping their interest intact was a very, very critical element in not derailing all the work we have done and built up so far, including the investments at LACUSC and other parts of the district. So a big shout out to Inner City Struggle and many others on this forum today who helped and advocated for protecting communities' interests. Thank you so very much. And finally, for projecting the map today, that was very helpful. Thanks a lot, Ruby.
Thank you all. And again, if you have any other questions, otherwise I'll hand it over to Rosa.
All right. Wakaz and Ruby, thank you so much for your reflections and for sharing, the importance of this process. For many of our advocates in our community is the first time going through this process. And so a lot of learnings from this, a lot of opportunity for us to continue to build, right, toward equal representation, toward opportunities, right, as we move forward in this and learn from this process and move forward into future opportunities. So definitely more time to reflect. This particular item was brought up by our co-design team, so I want to appreciate them for ensuring that we always have very intentional updates about particularly those systems and processes that affect most our community, right, and our community strength. So want to thank you all for those efforts. Want to send it back to Heather I believe, and I'm sure I'm going to come right back on because I think we're rejuggling the schedule. Just appreciating everyone. We're running a little bit behind, and we do realize that, Heather. So hopefully we can catch up with the next presentation.
Yes, you are correct, Rosa. And up next, we have the fabulous presentation by Miles and Rosa on the Care First Community Investment Advisory Committee. So, don't mute yourself, Rosa. You're right back up. With that, I'll invite Miles to kick us off and Rosa to join.
Okay, good morning, everybody. Thank you for having me. Happy New Year. My name is Miles Mishak, excuse me, and I'm part of the LA County CEO Alternatives to Incarceration Office. And Rosa asked me to come here and give you guys a little bit of background and update on what we're doing with the Care First Community Investment Advisory Committee, or CFCI, and this whole process. So, excuse me, this presentation is a little bit more about the background and how we got to this point so far, to make sure kind of catch you guys up. And then once we get to kind of what's happening this year, I thought we maybe just, kind of have a conversation. I'll do my best to answer any questions, and then hopefully I'll see all your faces and names attending our meetings going forward. So with that, let's get started. Again, this is just introduction. Miles Mishak. I'm also here is Rose. Obviously, Rosa Soto, who is actually a advisory committee member from SD1. So we're going to work together on providing this. And you can go ahead to the background. So I'm sure many of you are familiar with Measure J, which passed on November 3rd of 2020. And basically what it did was it amended the county's charter to require the county to set aside 10% of its locally generated unrestricted revenue for community investment and alternatives to incarceration. Now, I'm not a budget guy, but there is a difference between the totally unrestricted revenue and the restricted revenue. Restricted revenues, in my understanding, are often involve settlements, social services. The county will also take funds where they know there's going to be a federal match. They know there's going to be a federal match and consider those restricted as well. So these are unrestricted funds. And Measure J provided the county with 3 years to get up to the full 10%. So following the passage of Measure J, the county created the Measure J Reimagine Advisory Committee, whose goal was basically to solicit public opinion to inform the recommendations that would ultimately come for the use of the Measure J at that time, or CFCI funds. So following that, the CEO approved $100 million to be the year one allocation for Measure J. And those would be the funds that will be used to fund these programs that we discussed. So following that, in 2021, the Superior Court ruled that Measure J was unconstitutional, basically saying that it prevented the board from its right or its ability to, or its duty, excuse me, to create the county budget. However, the decision doesn't necessarily end Measure J. It doesn't prevent the board from still following this plan. It just says that the board can be required to follow this plan, basically. So following that, the county changed from the Measure J to calling it Care First Community Investment, or CFCI. So in addition to following the year one process, which we'll get into a little bit more, in addition to those original $100 million in CFCI funds, because the Measure J Advisory Committee actually recommended with their first, second, and third tier, I think it was like $900 million, although having been informed that the first year payout would be $100 million. So what the board did was it took advantage of American Rescue Plan, or ARP funds, and added another $87 million to the original $100 million to also fund programs that were within the spirit of Measure J. Slide, please. So in August of 2021, following the ruling on Measure J, the board adopted, or kind of replaced, the Measure J committee with the CFCI Advisory Committee, which is kind of where we are now. And that committee is made up of county departments, county representatives, several CBOs who are on the ground doing the work as far as community investment and alternatives to incarceration, labor partners, and individuals with lived experience with the Justice Department, with homelessness, in order to make, having informed people who with lived experience is a huge part of the opinions, the public opinion that we like to solicit as far as how these funds should be used. So now the slide you see now is a little bit of background on how Measure J actually worked. And this is going to kind of give you a little background on how last year's process worked. So again, you see it was approved in 2020 and it's 10% of the locally unrestricted funds, 3 years to build up to that target, and a little bit of information on how what makes up restricted funds. These are funds over which the county lacks discretion. Again, legal settlements, debt service payments, social programs, contractual agreements, and others. So the funds that were going to be used were the unrestricted funds. There were, in the original Measure J motion, there were 9 areas that were called out, as far as 5 for direct community investment, and then 4 for alternatives to incarceration. So you can see those here: youth, workforce development, housing support, capital funding to actually create more housing, as well as alternatives to incarceration. That's diversion programs, mental health, substance abuse support, reentry programs for those, reentering society after having been incarcerated, and restorative justice programs. Slide, please. So again, this slide kind of explains the year one. And the reason I'm going into year one is the process for year two, how the recommendations will be funded, is still being created. So definitely a good time to participate in our programs, but we'll talk about that later. So again, you see in November 20, we have these 9 funding areas that are identified. Throughout that process, in the year one, the Measure J committee created 5 subcommittees: education, access, and youth, economic opportunity and sustainability, housing, diversion, behavioral health and health, and then again, reentry. And what these subcommittees did, we met, I heard someone talk about meeting till 10 o'clock. These meetings were, we had 2 subcommittee meetings each night because we were under a tight to provide these recommendations. But what these subcommittees did, their charge was to, again, solicit public recommendations, public opinion, and then take that back to the actual full committee. The full committee's job, and again, it's an advisory committee, so the committee doesn't necessarily have any policy-making power, but the Measure J, or the committee, and similar to the CFCI advisory committee this year, their role is to, again, get the public opinion, make sure that the recommendations that they produce are informed by public opinion, pass those recommendations to the CEO. The CEO then prepares a recommended spending plan, which goes to the Board of Supervisors, who has the ultimate authority as far as determining how the funds will be used. So again, it is an advisory committee. Slide, please. So we probably could have left it. So basically where we are this year is the CFCI Advisory Committee is meeting. Actually, we had a meeting last night, and we are just entering the stage of how we will, or I should say not we, how the committee will fund its recommendations, how it will direct its community engagement. We did hear throughout the entire process that perhaps we had not completed enough community engagement, although we have maybe, I think, 8,000 people on our ATI listserv. We did our best to push it out, but we consistently heard people on meetings saying this was the first they had heard of it, they weren't aware. So again, part of our reason for being here is to attract you all to come and be a part of this process. We definitely want public opinion, and we want to focus on groups that are traditionally overlooked, that are traditionally not heard. Again, people with lived experience, people who are on the ground doing this work and serving the community. So as far as how that process will work this year, that's being formulated now. And I definitely think it would be good if you guys are interested in this to come and start to attend the meetings, because we want to hear your voice. You can move to the next slide, please. So just kind of, and again, this was an intro. We can still continue to talk. I'll do my best to answer any questions, but I wanted to draw your attention to a couple of things where you can gain additional information. So here's the ATI website. Here you can get meeting materials, agendas, presentations, the minutes of the meetings. This is a way potentially perhaps to catch up to where we are this year. As I saw someone put in the chat, our next advisory committee meeting is January 20th. We typically meet first and third Thursday of every month. That schedule changes sometimes because of additional meetings are needed or special meetings are called, but that's our typical schedule. And again, you can find all this information on our website. If you would like to be added to the ATI or CFCI distribution list, you can send an email to our our email address, or if it's your first time going to the website, you'll have an opportunity to sign up for a newsletter. Our office also handles other projects, so you can either set up for kind of strictly CFCI information, or if you're interested in the other projects that we're working on, which include youth justice, alternative crisis response. We have several diversion programs that we're putting into motion. You can also get information on that. And if you are a CBO associated with the CBO, or you know people who might be interested in looking for funding opportunities once this money actually starts to get rolled out into the community, all of the funding opportunities can be located at that bottom website. So if you know anyone who might, have programs that would meet some of the requirements, solicitations, please encourage them to apply. Also, I forgot to mention that the year one information, the year one spending report, all that is also available on our website. So we encourage you to come, get caught up. And again, looking forward to seeing all your faces and names during our meetings going forward. So with that, I want to keep it brief. That's kind of just a little introduction to how we got where we are today, and hopefully we'll see some of you there. And with that, I'll take some questions if anybody has any.
Miles, thank you so much for your overview, and particularly the resources where people can get more information. Really appreciating that there is this information that people can reflect back on. I think your PowerPoint also really gives us a sense of where you have been in year one. And again, everyone, a reminder, I am your representative for Supervisorial District 1, and inviting everyone to participate in that process, because the funding that CFCI provides and is prioritized for is really aligned with the community benefit framework that we have developed under the Health Innovation Community Partnership. So I have seen from other districts the importance of those advocates coming to the table, talking about the needs in their community, and seeing how that might be aligned with either some of the programming that departments are pushing forth in these efforts, as well as some of the initiatives that are being offered through the contracting process. And just lastly, want to mention that as you mentioned, Miles, there is funding opportunities available, but I think beyond what is available, if you make it into the approved list, then you are eligible for future opportunities and particularly contracting opportunities. So there's a couple of different ways to continue to be involved in this. And so again, just want to flag that we will ongoingly be bringing opportunities for progress within the CI here to the HICP table. Thank you everyone for your time. And I just want to see back to you, Heather, because I know we're running low on time.
I just want to add one thing. I saw someone in the chat asking for the link. Rosa and the other facilitators of the call have the slideshow, so please feel free to share it with everybody on this call, which has the information. And also, again, gives you, advises you on how to ask us questions or get additional information going forward. So please feel free to reach out to us.
Sounds great. Thank you so much, Miles. Thank you so much, Rosa. As Miles mentions, we do send around the slide deck after every meeting. It will have those links live for you. It'll also be available on the hicpla.org website after we post the meeting transcript and recording. So please stay tuned for more information there. But as mentioned, we have one final presentation, and we want to We don't want to miss out on this one because it's a really exciting initiative that this body has been part of since the very beginning. It is our General Hospital Feasibility Study relaunch. And with that, I'll ask my colleague, Alex Villalobos, to please kick us off today on relaunching this fabulous project. Alex, you may be muted.
Stole my own thunder. Thank you. Sorry about that.
All that brilliance, we missed it. You'll have to repeat it for us, Alex.
Happy New Year, everyone, and happy 50th anniversary, HICP.
Oops, wrong one. Sorry.
Oh, no worries. No worries. I'm ready to go. My name is Alex Villalobos. I'm with Barrio Planners and a proud member of the General Hospital Reuse Study Team. So good morning. It's great to see so many familiar faces and so many new ones. I hope all of you were able to enjoy the holidays. We have had yet another challenging year, but with all the exciting efforts to improve our community that I have seen, I know we have so much to look forward to in the coming year. I'm proud to see all the leadership and community partners I see present and available this morning, and look forward to all the positive changes we'll all bring. This work isn't spontaneous, and we should all be proud of all the work that we have done to nurture our community throughout the pandemic and moving forward. So today, I'm happy to be out of the audience and privileged to be back into the presenting role to our Health Innovation Community Partnership, the relaunch of the General Hospital Feasibility Study, where we will now reconvene our efforts to move forward with assessing how this invaluable county asset can best serve our communities, the LAC USC campus, and ultimately the most vulnerable among us. With the leadership of the First District Supervisor Hilda Solis, our team will reconvene efforts to finalize assessment of this historic asset, absolutely maintaining a commitment to hearing the community and responding to their needs. So many challenges this past year, of which our leadership is well aware, as we heard Supervisor Solis mention at the beginning of our meeting. The needs of our community have increased, and therefore it obviously follows that the needs for facilities and other means to deliver those resources are just as vital. So opportunities will present themselves this year. And as Supervisor Solis mentioned, regarding funding sources requested from Governor Newsom's office, we will need to move on these opportunities. The next phases of this project will move swiftly, strategically, and with every effort to maintain an environment that will be sustainable and have absolute benefit to the campus in service to our communities. So from our team, beginning with Supervisor Solis in her office, the County of LA's CEO's office, AECOM, the Wellness Center, our dedicated steering committee members, Catherine Padilla and Associates, and Said Barrio Planners Incorporated. I thank you, HICP, for your time and allowing me the privilege and helping me kick off and rejoin and bring back this project. So thank you very much. And with that, I ask my colleague Heather Hayes with the Wellness Center to lead us through our presentation. Heather.
Thank you so much, Alex. Wonderful kickoff. So we have limited time here together, but what we really want to do is revisit kind of what has been accomplished to date and then where the opportunities lie ahead. So I'll kick us off by starting with the legacy of the General Hospital and the feasibility study and how we got here today. As we know, the General Hospital is an iconic asset in the landscape of Los Angeles. It opened its doors in 1933 to serve the most vulnerable citizens of Los Angeles County. Fast forward 60 years, and there was the earthquake in 1994. The Northridge earthquake caused significant damage to General Hospital to the point that it accelerated the timeline for funding a new medical center that could be more modern and meet the needs of the community and the population at that time. By 2008, General Hospital closed to clinical services, and the new medical center opened to continue the legacy of care on this campus. but the building remains in the heart and the history of Los Angeles. So the idea was brought forward of how do we bring life to this historic, iconic asset? And a $10 million investment was raised to build out the first floor of the General Hospital and create the Wellness Center. We go forward a few more years, and then with the Wellness Center intact and providing comprehensive community services on the first floor of General Hospital, what can we do with the rest of this incredible facility, all 19 floors of it? So in 2018, Supervisor Solis had a unanimous assent by the Board of Supervisors to institute a General Hospital reuse feasibility study to examine what could be done to bring this asset back to community service and to full functional life. In 2019, we began this journey with community engagement and technical analysis working side by side to explore the potential of the site as well as the needs of the community. Unfortunately, when we hit 2020, we hit a slowdown because of the pandemic and having to redirect services to redirect some of our resources assigned to this study to other projects and priorities. But it was always in the back of our mind that we couldn't wait to get back to this project. And now here we are. We're in 2022 now, but in 2021, just a few months ago, we restarted the engagement around General Hospital feasibility study. And we're so excited to announce that there is now this hyper momentum to drive to conclusion and conclude this study in 2022 with a report to the Board of Supervisors, the issuing of an RFP, and developer selection to help fulfill the promise of General Hospital. So when we think about what was the study directing us to do, well, the first is, as mentioned many times, the iconic county asset, bringing it back to life. But paired with that were the needs that are happening in the community today and how this asset can be used in service of those needs. So the idea is to address the tremendous need for housing, to provide complementary services on this campus that might provide true wraparound services in complement to the Restorative Care Village, as well as the Wellness Center. Really looking at a mixed use approach to the campus that includes housing as well as other uses. And then once again, underlying the vision that Supervisor Solis has for the healthy village, making sure that we have a whole person concept and approach to care, and that we are supporting a healthy, resilient, economically prosperous community in East Los Angeles and helping our vulnerable populations. We're moving towards developing an example of what's possible, the reuse framework. And to accomplish that, we now are moving forward to accelerate our study timeline to make up for lost time over the pandemic period and take advantage of potential funding streams that have become available this year. We heard a little bit from Supervisor Solis at the top of this meeting about some of those opportunities. We're very excited that this study timeline has enabled us to move to a request for proposals phase in order to attract creative, best-in-class proposals from multiple developers to ensure the project moves forward quickly. And we always will ensure that community voices are central to the study and to future phases of the project. General Hospital feasibility study process. As we look back in time, how have we gotten to where we are today? Indeed, we have this reuse framework development process that we've been following over the past few years. We started with our board motion and that healthy village concept we just described. Then the research happened, looking at the existing conditions and doing market research to see what's possible. We also explored the opportunities and challenges presented by a historic, iconic building that is getting close to 100 years old in just a few short years. Looking at key considerations, including what are the needs of the community, what are the needs of the county, and how can the campus best be put to service. We reoriented the process through this pandemic period so that we could move forward with an accelerated timeline. And here we are moving forward to our proposed reuse scenario, which we expect to be delivered to the Board of Supervisors in the final report in April of this year. So we are on such a short timeline now, and that's what we're so excited to share with you today, that we have accomplished so much. We've made so much incredible research, analysis, and progress, and here we are in the final phases. The reuse scenario will take into account this balancing of inputs and needs. We look at this graphic that describes the community inputs and needs put in balance with the county department requirements and technical challenges, and then we have to marry that up with funding sources and what's available to us today to ensure that this project can move forward quickly and come to fruition. We know that the technical requirements in county The county department requirements and technical challenges are significant. We know that there are necessary and extensive repairs and improvements that are challenging because of the historic nature of the structures. We also know that county has specific needs for this property that have been highlighted by the pandemic that we are all living through. We know that funding is going to be a tremendous challenge because it's going to be an expensive project, and we want to make sure that the best and most creative developers come forward into partnership with us. And then, of course, we have our community needs and the community engagement process to ensure that this project is accountable to serving the community and meeting those near and long-term community benefits goals that are been established by this project and by Supervisor Solis's direction for the study. So as we're looking forward to the community engagement purpose and goals, where are we headed in the next short months? The General Hospital Feasibility Study Community Engagement Strategy is really here to ensure that the study looks at the input, participation, and perspectives from a variety of stakeholder groups. We are working together to collaborate on various outreach activities that will inform the study, to be able to share the goals of the study and build community support, and to provide numerous opportunities for the surrounding communities and other stakeholders to offer their ideas and share their vision, values, and needs in relation to the reuse of General Hospital and West Campus. Historically, we've done a lot of work to date to learn from the community about those high priorities and needs. Through 2019 and 2020, we've worked with our Community Engagement Steering Committee, which has provided leadership perspective and representation of community perspectives through the process. We've participated in pop-up events to have an opportunity to share information about the study and receive some feedback along the way. We hosted an affordable housing and community benefits panel that enabled us to really dig in more deeply on what does affordable housing look like in the context of this project. We've hosted 3 community at large meetings to date, with 2 more to come this year. And we've hosted numerous stakeholder interviews, charrettes, additional meetings, and informal discussions, as well as presentations at multiple Health Innovation Community Partnership meetings during this time. Through the process, particularly focusing in our community at large meetings, we were able to engage hundreds of people at 3 different large community at large meetings, and we identified these key community issues that were raised up through the process. They include things like gentrification and displacement, the desire for more open space, concerns about transportation and parking, as well as a desire in the community for food security and grocery stores on our campus. These slides will be shared with you afterwards, so you can go in a little more deeply and look at all of these community priorities that have been elevated through this process. But I'm going to go a little more quickly because I know we're very short on time. One of the things that we're so excited about that we were able to offer out during the first phase of the project was the community vision mapping activity. This was something that was designed by our CESC committee, piloted at a Health Innovation Community Partnership meeting, and then brought forward to our community at large meeting on December 9th, 2019. We gave out to community residents a visual map of what does our campus look like today and what would they most like to see it be implemented as part of the future phases and development of the project. We received thousands of comments back that we were able to analyze and identify what are those priorities in terms of revisioning the campus as a mixed use and mixed housing space that will be of service to all. We heard comments through this process also, like thank you for the concerted effort to install new life and objectives to the General Hospital and make it relevant for LA to the future. I am a local business owner in Boyle Heights. I've personally seen the economic struggles that our local businesses face due to the lack of parking and the heavy concentration of low-income housing. I support a balance of economic development and social justice. Without a balance, our local businesses will not survive economically and be able to provide jobs. I believe in continual programming opportunities such as dance, art, support groups, etc., such as the ones already happening at the Wellness Center, are also critical to community empowerment. We heard so many rich comments from the community, and we're really taking those into account as we move forward with our reuse framework. How has this community input influenced our study process? Well, the first and most important thing that I want to mention is the fact that the study now incorporates part of West Campus. The motion originally spoke to General Hospital reuse, but as we were examining the campus and hearing from the community about the diversity of needs, it became abundantly clear that we needed more footprint and more opportunity to be able to address all of those needs. So West Campus was included as part of the study framework. We also adjusted the study timeline to allow for more time for community engagement, as well as more time for the technical analysis. That enabled us to really be very thoughtful as we move forward with the project and make sure we were really hearing all voices and having greater representation. We also went through the process and identified a greater allocation of square footage for community serving spaces. This was in direct response to an incredible rich set of needs and requests from the community in terms of what might be possible for this future campus. We did the community vision mapping exercise as previously described, and now we're really moving towards that expedited completion of the study in order to issue our RFP within the next year. We also plan for ongoing community input during the RFP phase and developer selection, once again, in response to the community voices that have been raised through this process and the incredible commitment of the community to this project. Also, how has the community input influenced the approach to housing? Well, as we can see here, community has really advocated hard for more affordable housing, and that has directed the study to consider to exceed the typical rates of affordable housing for a project of this size, to increase the number of 3-bedroom units that will be incorporated, to incorporate minimum requirements for percentages of affordable housing and preferred ranges of affordable units to be included in the RFP. So in making sure that we are very explicit about the minimum requirements for the percentage of affordable housing and the ranges of affordable housing that will be in the RFP as issued. We've also been able to conduct more detailed analyses and creative approaches to incorporating affordable housing mixes at deeper levels of affordability. That's really important because as we think of affordability, we have to be really responsive to what that means in the context of this community. And we were excited to host an affordable housing and community benefits panel in July at HICP to really once again dig in more deeply on what does it look like to build an affordable housing complex of this size and complexity. We've also, as mentioned, we are increasing our emphasis on community serving spaces overall, and with a particular focus to making sure that retail reflects local and healthy food options, restaurants and vendors, that office space may include entrepreneurial opportunities such as business incubators, social enterprise, and local business expansion, and that hospitality options may focus on nonprofit or low-cost lodging to support patients and families. All of these are ideas that were brought forth through the community engagement process and really are helping create that context for this study that really anchors it to the needs of this particular community and really drives it from a community needs perspective. We've also included transportation and mobility access improvements such as shuttles, walking paths, bike paths, and enhanced ADA accessibility, ensuring that there's open and green spaces available for public use, and adding commemorative and cultural art spaces. This slide really is emblematic of all of the creative thinking that has come together through hearing from the community and understanding the needs and priorities of our neighbors. We also have to balance that inappropriately with the county inputs and considerations. As we know, county will maintain ownership of the land and the structures here on the campus. They also need to continue to operate multiple public facilities nearby and on the campus to include the world-class LAC USC Medical Center. It's our priority to ensure that our medical center remains the jewel in the crown of the healthcare system of Los Angeles County. We want to, of course, address those needs for affordable housing as outlined for the board motion. We want to ensure that the historic asset is supported and maintained on a long-term basis. And we want to result in an RFP that attracts best-in-class proposals from qualified developers. We also have to balance those technical considerations that we mentioned. So here are just a few of them. The general hospital is old, it is large, it needs major renovations. It's now at 89 years old, 19 stories, 1.2 million square feet. It's largely vacant, but needs a lot of support to become useful in any context. Environmental remediation, structural improvements, and comprehensive renovation. It's also eligible for National Register of Historic Places. When we pivot to West Campus, which is largely, which has many undeveloped areas at this time, we know that West Campus really needs to support and sustain the core functions of our world-class medical center, of the Restorative Care Village, which will be opening in spring this year, as well as the expansion of the Restorative Care Village in phases 2 and 3, which are to come in the future. We have a central utility plant, a helipad, accessibility and easements, as well as parking considerations. Here's our visual of the site that we are talking about. We have our historic General Hospital on the right. It's grand 19 stories tall. And then we have the West Campus with its core functions that need to be maintained, as well as some of the opportunity sites for future development. We are looking at the Restorative Care Village Phase 1, which is opening, as I mentioned, very soon, with 160 beds at present scope. There will future phases will be included that will include up to 300 units. So that's a really significant consideration to take into account as we move forward. Looking ahead and where we are now, Community Engagement 2022. This is where you guys can get engaged with us and involved and share once again your perspectives and feedbacks on the proposed reuse scenario and our planning. We will be hosting monthly Community Engagement Steering Committee meetings. Next slide up, in a couple slides, I'll be showing you the membership of that committee. We'll also be here regularly to present at the Health Innovation Community Partnership. We'll be reinstituting regular social media outreach, website, and media opportunities with regular updates to our website, as well as regular social media postings. And we'll be participating, and then we'll be hosting 2 bilingual community at large meetings. We really need your support and help to get people out to those meetings. These will be hosted via Zoom, and they will be open to all. It'll be a great opportunity to review what's happened to date, what we've heard, and where we're headed. We'll also be participating in some ad hoc community engagement and education opportunities, including the Wellness Center 8th anniversary, which will be hosted on March 14th, and doing regular presentations at community meetings as invited. After our report is delivered, the Board of Supervisors will determine next steps that will lead to new community engagement opportunities in the post-study phases, such as the RFP and subsequent developer selection phases. Here's just a quick overview of our website. You can visit us and get the most recent information at any time at hicpla.org. Looking at the tabs on the top, click on the General Hospital Feasibility Study to learn more about the history of how we've gotten here and what the next step opportunities are. Here we see a list of our Community Engagement Steering Committee members for 2021 and 2022. I want to just really kind of show a lot of appreciation to the members of the Community Engagement Steering Committee who have been with us faithfully through this journey for many, many months and are here to kind of see us through the final phases of this project with their leadership, their wisdom, and their representation of community interests and needs. We have here a moment or two perhaps for Q&A. Not too much time, I'm sorry, because we've already overrun our time here today. But if we do have some quick questions, I'll turn it back over to Alex to facilitate some Q&A. Any questions from the audience?
Well, first of all, Heather, this is Lourdes at USC, and thank you. That was an absolutely great presentation, and thank you, Alex, as well. I was just curious as to when would be the overall completion date for something of this magnitude, if you have an anticipated date in the future.
Thank you, Lourdes. Yes, the report of the study completion date is anticipated for April 2022 when the report will be delivered to the Board of Supervisors. And then, of course, we have hope that the RFP will be issued shortly thereafter, and then we will move into the actual project phases. In terms of timeline beyond that, I would defer to our colleague Ivan Matthews, who might have more information to share on that.
Sure. Good morning, everybody. Lourdes, thank you for your question. We don't know when the project would be completed, and it's probably multiple projects, because if you take a look at General Hospital, that's a massive redevelopment by itself. And then the West Campus could potentially be several different residential buildings and retail, and all of those would have to be phased. So we're hoping through the feasibility study, we can identify a potential timeline. But then it'll be really interesting when the RFP goes out and what the development respondent teams come back with on how long they think it will take them to deliver General Hospital and different buildings on West Campus, because they have to take into consideration funding and how many units can they lease up very quickly, and construction and materials, and a lot more details that we're not getting into with the feasibility study.
Thank you. This is beyond exciting. I'm really excited about this.
Thank you so much, Lourdes. Is there anyone else? We have comments coming into the chat. Are there opportunities to leverage Build Back Better federal funding opportunities from Ari? Perhaps let's see if we can answer that question. Can we fill that, Ivan?
Sure. I was going to see if Guadalupe or Cas were on the call and wanted to answer that question.
And rest assured, if we're not able to answer these questions this morning, that we will be following up, and there's always opportunities to reach out to Heather or myself with anything you have further.
Yes, and as you just mentioned, Alex, we will be bringing more regular updates to HICP to kind of bring you along this process with us over the next several months. It's only a few months at this point, so stay tuned. I'm pretty sure we'll have regular updates for you every month. The funding considerations is definitely something that we are looking at right now. In terms of Build Back Better, I don't have an update on that one because it's been kind of I don't know where it even stands in the federal funding landscape right now. So I'm not sure, Ivan, if you have a quick comment on that.
I don't, particularly to Ari's direct question on that one funding source, but we are taking a look at a plethora of federal, federal, state, and local funding sources to try to leverage as much public funds available to the reuse of General Hospital and West Campus. But again, this will be just incorporated into the feasibility study. When the RFP goes out and the developers really put pen to paper, they're going to continue to dig into potential funding sources. And hopefully by that time, the supervisor will have been successful in identifying some additional funds that we can leverage towards General Hospital and West Campus.
And that makes me think about one of the comments that Supervisor made at the top of our meeting today about putting a request forward to Governor Newsom, and his budget will be released shortly. That may include some earmarked funds for this redevelopment.
Is there anyone else with any more questions? Chip chat.
It's 11 o'clock.
It's 11 o'clock.
I guess it is, Alex. That's great. I think I need to install that on my device.
Oh, I need to turn mine off. So do we have any other questions? I don't see any other hands raised. We have some gratitudes in the chat. Thank you so much for your comments, everyone. Please, don't forget, we have a lot of other upcoming exciting meetings and opportunities for you to reach out to us, Heather and I. Please.
Alex, sorry, go ahead, Heather.
No, you first, Ivan.
I was going to say, last but not least, I think there's one more slide on there with your guys' contact information and the link to the website.
There sure is. Yep. So as mentioned, we'll be back visiting with you February 4th, March 4th, April 1st, and May 6th to share updates on the study at these upcoming Health Innovation Community Partnership meetings. We also will be asking for your help and support in promoting and getting a larger representation out to attend and participate in our next two community at large meetings. The first one is scheduled for late January, early February. And the second meeting will be in early April. Those will both be hosted via Zoom, and we will be promoting them out as soon as we have those dates confirmed. They will be bilingual with simultaneous translation available. So we're very excited to be hosting those meetings and look forward to your participation and invitations out to community you work with. As Alex mentioned, we are both here to hear from you, to connect you back to this study as needed. Please feel free to reach out at any point. We'd be delighted to hear from you. And with that, we already did the partner reflections and sharings a little bit earlier in the meeting, but I just do want to echo one last time, 50 meetings over 5 years. It's a really exciting accomplishment. We're so delighted to have seen people stick with us from a pivot from in-person meetings to virtual meetings. from this incredible journey through the pandemic that started in 2017 with the Health Innovation Community Partnership membership of 40. And now here we are. At one point in this meeting, I think we had 72 attendees. It's been an exciting journey, and we feel very proud of what we've been able to accomplish together to create this equity conversation where people engage in dialogue with one another and really get to, to voice their concerns and their priorities, to ensure that the community voices are elevated in this process, and we make sure that that all have a seat at the table. With that, I will conclude today's meeting. Thank everyone for your participation. Thank our fabulous presenters for all of their great, insight and the active engagement in conversation and dialogue with our participants. We will see you all hopefully in 1 month's time on Friday, February 4th, right back here.